Hello and welcome to Last Week Tonight. Tonight's topic is a real downer: Tramadol. It's a painkiller, sure, but it's also highly addictive. And it's a huge problem in Liberia. Imagine a country still recovering from civil war. Unemployment is high, hope is low, and then Tramadol comes along offering a cheap and dangerous escape. Criminal networks are making a killing, smuggling in super-strength pills. These pills are way stronger than anything you'd get with a prescription. Street vendors like 19-year-old Henry Kane see Tramadol as easy money. But the cost to their communities is devastating. Godwin Tai and his group are trying to help addicts in Monrovia's slums. They see the desperation firsthand. People like Isuf, a construction worker, turn to Tramadol just to cope with the daily grind. But Liberia is just one piece of the puzzle. Thousands of miles away in India, another story is unfolding. This one involves a company called Lucent Drugs. Now you might think a company called Lucent would be all about transparency, but you'd be wrong. This company was shipping Tramadol illegally to Pakistan. Not exactly a glowing endorsement for their brand, is it? Luckily, the Indian government caught wind of their little scheme. The Enforcement Directorate, or ED, swooped in and seized assets worth 5.67 crore. That's over $500 million rupees. Clearly someone was making a lot of money off of other people's misery. This case just goes to show how far-reaching this problem is. It's not just about individual users, it's about organized crime profiting from addiction. Now, let's bring this home to America, shall we? You might be thinking, John, this is depressing. Can't we talk about something lighter, like, I don't know, basketball? Well, guess what? Even the NBA isn't immune to the Tramadol problem. Just ask Bobby Portis. The Milwaukee Bucks player was recently suspended for 25 games. Why? You guessed it, violation of the NBA's drug policy. Now, we don't know the specifics of Portis's case, but his suspension shines a light on a much bigger issue. Athletes, like anyone else, can fall victim to addiction. And the pressure to perform, the constant pain, can make them vulnerable to painkiller abuse. It's a reminder that this problem can affect anyone, anywhere. Section 4. Tramadol's long shadow, health, legal, and social implications. But let's be clear, Tramadol isn't just bad for individuals, it's bad for society as a whole. We're talking about a public health crisis. Tramadol addiction puts a strain on healthcare systems, especially in developing countries. Then there's the legal side. Illegal trafficking, like what we saw with Lucent Drugs, fuels organized crime and corruption. And let's not forget the social impact. Families are torn apart, communities are destabilized. It's a vicious cycle. Section 5, a global crisis, the need for action. So, what's the solution? Well, it's complicated. We need better addiction treatment programs, stricter regulations on pharmaceutical companies, and international cooperation to crack down on trafficking. We need to educate people about the risks of Tramadol and provide support for those struggling with addiction. But most importantly, we need to change the way we think about addiction. It's not a moral failing, it's a health issue. And it's time we started treating it that way. That's our show for tonight. We'll leave you with this sobering thought. Until we address the root causes of addiction, the Tramadol crisis will continue to cast a long shadow over the world.